This is a true story, a story you may have heard again and again. It was a mistake, an impulse, or carelessness. You might have thought that it was nothing, or you might have had thousands of excuses. At the end, it is too late. Today, we will review our knowledge on HIV. First, is being infected with HIV still scary?
Sorry for interruption. Not so much like in the past. First, you must understand that HIV infection destroys your body's immune system. If left untreated, then it's scary. HIV will destroy your immune system and advances to acquired immune deficiency syndromes, or we call AIDS, and may cause opportunistic infections, which is the final stage of HIV. On the other hand, people living with HIV, or we call PLHIV, who received early antiretroviral treatment and have a good antiretroviral adherence, can achieve viral suppression. In most cases, they will not progress to AIDS or transmit HIV to others. They can expect to live almost as long as or as long as those without HIV.
Doctor, who are considered risk group?
People who have unprotected sex, people who do not know their sexual partner's HIV status, people who share needles with others, and children born to an HIV-infected mother are at risk of HIV infection.
What if someone has had risk behaviors? How would they know if they are infected?
The only way to know if someone is infected with HIV is to get HIV tested. Currently, HIV screening can be performed using blood or oral fluid. Thai citizens are entitled to 2 free HIV blood testing per year. Don't be shy, and please don't be afraid to get HIV tested.
What if a person is afraid to get tested? Are there any symptoms indicating that they are infected with HIV?
During the early stage, symptoms may appear as flu-like symptoms such as fever, sore throat, fatigue, rashes, and enlarged lymph nodes. During this stage, people living with HIV have very high viral load in their blood, so they can easily transmit HIV to others if they engage in risky behaviors. During the chronic HIV infection stage, people living with HIV may not have any symptoms. Without ART, they can transmit HIV to others. As years go by without treatment, HIV can weaken their immune system and advance to AIDS, causing various complications such as opportunistic infections, neurological complications, and different types of cancer.
Everyone should include HIV testing in their annual physical exam, right?
That's right. The earlier you have HIV testing, the faster you know your status. If you have HIV negative, you can continue with HIV preventive measures. Suppose you have a risk behavior within the past 3 days, the doctor can prescribe post-exposure prophylaxis, or called as PEP, to lower your chance of infection. For people with continual high-risk behaviors, the doctor may prescribe pre-exposure prophylaxis, or PrEP, and recommend having safe sex or using a clean needle and not sharing it with others. In HIV-infected pregnant women or those desiring to be pregnant, the doctor will advise you on safe pregnancy and give you antiretroviral treatment and prophylaxis. If you test positive for HIV, the doctor can treat you earlier by prescribing ARVs. With undetectable viral load, you will not transmit HIV to those you love. This is called U equal U, meaning undetectable equal to untransmissible. Preventing HIV from weakening your immune system and advancing to the final stage of AIDS reduce your chance of having opportunistic infections, heart diseases, neurological complications, kidney disorders, and cancers. Today, Thai citizens have free access to ART, PrEP, and PEP.
I worry about having to take ARVs. Do I have to take many tablets? How many times do I have to take in one day? I'm afraid it will affect my daily life and have side effects. Will I have drug resistance?
These days, ARVs can easily be taken at least 1 tablet a day. A single tablet consists of 3 drugs. Dizziness or insomnia rarely happens as side effects. This daily single tablet can be taken between or with meals. This regimen is more durable and difficult to cause drug resistance compared to other ARV regimens. Not taking it exactly on time or forgetting to take it one day will not instantly cause drug resistance. Each patient living with HIV may receive different ARV regimens depending on their health conditions, the virus drug resistance level, drug adherence, and body weight. With good drug adherence, people who test early and receive treatment early, particularly those at a young age, could have a life expectancy as long as 70 to 80 years.
Do you have any other advice?
Lastly, I would like to tell everyone with risk behaviors to think twice. And if you are not sure you might have had risk behaviors, please go get tested. With early testing and treatment, good drug adherence, and most importantly, don't expose more HIV. You can have a good quality of life, a life expectancy as long as 70 to 80 years, just like others.
Thank you very much, doctor. Let's go get tested, everyone.